A fresh new report is offering first estimates of the prevalence of Alzheimer's disease in the U.S. at the county level.
Very interesting stuff. Now, it determined that seniors living in the East and Southeast regions of the country are most likely to have the debilitating disease. Data published in the Alzheimer's Association's journal suggests that rates for Alzheimer's are highest in Miami-Dade County, Baltimore, and the Bronx. And at the state level, the disease is most common in Maryland, followed by New York and Mississippi.
Joining us now to discuss this is Dr. Dona Murphey. She's a neurologist and promotora, or community health worker and liaison when these studies are being done. Great to have you with us. Donna, explain why Alzheimer's disease might be most prevalent here in the East and in Southeast regions.
I think what we understand about those geographic data are that it's driven largely by social determinants of health. And so where people have access to health care, where they have access to healthy food, educational access, obviously, where they have access to exercise outdoors in a safe manner. All of those things that actually influence cardiovascular health have pretty profound implications also for incidence of Alzheimer's disease.
This is so interesting, Dr. Murphey. I'm wondering, because you sort of think Alzheimer's would affect the population universally without regard to where people live. How important are these findings for medical experts then?
Yeah, I mean, I think we need to be careful here. It's not necessarily precisely the geography of where people live. I think it has much more to do with kind of the resources of where people live and how those are disproportionately distributed among different populations. So something that we know, for instance, we've known for quite some time is that Alzheimer's disease is racialized in how it happens. And, that I think is also reflected in data that is geographically specific, right? So in certain places, you have a predominance of certain populations, and those populations may have disproportionate incidence of this disease. And it's largely because of those social determinants of health that we discussed, which are themselves racialized. So that, I think, is important to recognize.
Right. Oh, I see what you mean. Correlation does not necessarily mean causation, but it is another data point which suggests where you are socioeconomically can have a massive impact on all sorts of health outcomes. I want to turn our attention to a different dementia-related study, though, because data published in the Lancet journal found that hearing aids may cut the risk of developing dementia in half for people facing a greater threat of cognitive decline. Why might that be?
Right. And this is super interesting. It's not actually limited to hearing deficits or hearing loss. It's also true for, we're finding more and more, true for other sensory disturbances. So for instance, visual loss, it seems also to be in some way correlated with dementia. So for hearing specifically, there's a very strong relationship. It appears that you can reduce, as you're showing there now, the impact of this disease by nearly half, right? And that is fabulous because this is a relatively accessible, I think, especially in the last year since the FDA has now approved hearing aids to be available over the counter. This is a relatively accessible intervention, right? So now, rather than being $2,000 to $4,000 for each hearing aid, you can get them for around, $1,500, hopefully, with some of the competition on the market for over-the-counter hearing aids.
But do we know the why?
Yeah, I mean, so I think some of it is that it prohibits you or it limits you in your ability to engage socially, right, with other people. And we think that social interaction is really very critical for keeping people sharp cognitively. So that certainly, I think, is contributing.
We hear you hear so much about neuroplasticity and the importance of keeping your brain sharp by keeping it active. Yeah. I'm wondering, since your vision, your hearing, have all these effects on dementia and cognitive decline, do you encourage all of our people who are listening out there who maybe are hesitant to get their hearing checked out or wear a hearing aid or glasses or corrective surgery for vision? Do you think that all of that part of the argument to all of them needs to be you have to do this if you want to keep your brain sharp as well? Or are we taking that too far?
No, I think that that's actually a really great argument to make, to try to compel people to do those things. I will say that, of course, it's the accessibility of those interventions is limited still, even though, hopefully we're going to see these things become more accessible. This is why it's so important that things like Medicare, Medicaid expansion, things that help the people who are lower income and usually find it more difficult to access these interventions will also have access to them. Because as I said again, the disease disproportionately impacts some populations more than others, and those also tend to be the same populations who are resource limited in many ways, right? So it's important that not just, beyond just doing the advocacy that people should in general do these interventions, we have to kind of make policy changes to enable people to get these things, to access these things.
Yeah, and the more data, the more studies showing the connections, the more that we can all do. Really fascinating
So
stuff.
interesting.
Great to have you here with us to walk us through all of it, Dr. Dona Murphey. We appreciate it.
Of course, thank you.